welcome to the deep dive. You've sent us some really compelling material looking at the history of disease, particularly since 1900 or so.
That's right. Some fascinating sources.
Yeah, so for you, we're going to really dig into these accounts, the medical progress, but also, importantly, its limitations, especially when facing these ongoing disease challenges. Our goal here is basically to pull out the essential knowledge tailored for you so you get a thorough understanding pretty quickly without getting bogged down in maybe unnecessary details.
Exactly. We'll be exploring, well, a few key areas. There's a stubborn persistence of diseases linked to poverty. That's a big one.
All right.
Then the huge impact of epidemics and pandemics, how they disrupt things but also drive change.
Okay.
And finally, the sort of newer challenge of diseases that pop up more as people live longer.
So kind of a focused look at how disease has really shaped human history and, well, our development since the 20th century began.
That's the plan.
Okay, let's start with those diseases tied to poverty. It's quite a stark reminder, isn't it, that even with amazing medical advances, access is just not even.
Not at all. The sources really hammer this home. You can practically map certain diseases onto global wealth distribution.
Yeah, the correlation is striking. Let's take malaria, for example. Spread by mosquitoes, mostly in warmer, tropical areas.
Classic example. Causes those flu-like symptoms, but can be deadly.
And we have interventions, right? Medical treatments, practical things like mosquito nets.
We do. Relatively simple solutions, in theory.
Yet the material highlights this awful reality. Hundreds of thousands still die every year, mostly in places like sub-Saharan Africa.
It's tragic, and it perfectly illustrates that gap between knowing what to do and being able to actually do it everywhere.
So if the solutions are, as you say, relatively simple, what are the biggest roadblocks? Is it just money? Or is it more complex?
Oh, it's definitely more complex than just funding, though that's obviously crucial. You run into huge infrastructure problems. Think about keeping vaccines the cold chain in remote, hot areas.
All right, logistics.
Logistics, political instability, conflict. These things completely disrupt healthcare delivery. And then there's public awareness, education, making sure people know how to use nets properly, for instance.
So it's this whole web of economic, logistical, social factors.
Exactly, a really complex interplay.
And it sounds like a similar story with tuberculosis, TB, that airborne one affecting the lungs.
Very similar pattern.
Your sources point out, and this is kind of stunning, a cure was developed way back in the 19th century.
That's right. A long time ago.
But it's still a major killer in many poorer nations, it almost seems.
Yeah, unbelievable that a curable disease persists like this just because people can't get the cure.
It really underscores the point, doesn't it? Medical breakthroughs are vital, but they're not the whole picture. TB's continued toll shows these deep systemic inequalities in healthcare access.
Poverty just creates the conditions for these diseases to thrive, even when we technically know how to beat them. Precisely.
And then there's cholera, caused by bacteria in contaminated water. Something so basic.
Fundamentally basic, yes.
The symptoms sound horrific: vomiting, diarrhea, severe dehydration, and around 95,000 deaths a year still?
Still, it's heartbreaking, like you said, and the link to poverty is just so direct. It's about lacking clean water, lacking basic sanitation.
It's not some complex mystery virus, it's infrastructure.
Yeah.
Or the lack of it.
Exactly. Cholera really drives home how crucial those environmental factors are. Clean water, sanitation. Sometimes that's just as important, maybe even more so in some contexts, than the medical treatment itself.
Okay, so that's the poverty dimension. Let's shift now to epidemics and pandemics. The sources really emphasize their massive impact. Huge social disruption, obviously.
Massive.
But also, interestingly, they often act as catalysts, right? Pushing medical science and public health forward.
Absolutely. It's this strange dual nature. Terrible suffering and loss, yes, but also these moments of intense pressure that force innovation and make us rethink everything.
So we've seen how inequality makes endemic diseases worse. Now, how do these big outbreaks expose those vulnerabilities even more and maybe drive change?
Well, the 1918 influenza, the Spanish flu, is just a giant example from the sources.
Right, the deadliest of the 20th century.
By far. And hitting right at the end of World War I, just unimaginable devastation piled on top of devastation.
The scale is hard to grasp. Nearly 50 million deaths in just 2 years.
Almost unbelievable numbers. And what's key is how fast it spread globally. Because the world was becoming more interconnected even then. Travel, trade routes.
It paints that picture of globalization having downsides, even for a century ago. a risk multiplier for disease.
Definitely. It really highlighted those vulnerabilities. And crucially, medical science back then just didn't have much to throw at it. No effective vaccines, no antivirals like we have now.
A real feeling of helplessness, I imagine.
Absolutely. And the demographic hit was huge, especially in working age adults. That had massive, lasting economic and social consequences.
Okay, then moving forward a bit, we have Ebola. Very different disease, much higher death rate, even if it doesn't spread as easily through the air like flu.
Yeah, Ebola is terrifying because of that lethality. The sources mention around a 50% mortality rate.
Just staggering. And we've seen those terrible outbreaks, Congo in '76, West Africa in 2014, over 11,000 deaths there.
And the sources mention a current outbreak in Africa, reminding us it's an ongoing threat.
So, Spanish flu showed the risk of a fast-spreading novel virus in a connected world. Ebola shows the danger of extreme lethality, even with less easy transmission.
Exactly. Each outbreak, horrific as it is, forces us to learn and improve how we contain these really high-consequence diseases. It tests our systems.
Then more recently, HIV/AIDS. Starting in the '80s, millions of deaths globally.
A profound global health crisis.
The source explains how HIV attacks the immune system itself, targeting specific cells, right? Leaving people vulnerable to everything else.
That's the mechanism, yes, leading to AIDS.
And it's, well, disheartening to read about the early days, the struggles getting research funding because it was initially associated with certain marginalized groups.
Yeah, that's a really important and frankly shameful part of the story. Stigma and prejudice absolutely hampered the initial public health response and the research investment.
A pattern we've seen elsewhere too, unfortunately. Social factors getting in the way of science.
Absolutely. But then the development of effective treatments in the 1990s was a huge breakthrough, a major turning point.
Right, turning it from a death sentence into something more like a manageable chronic condition, at least in parts of the world with access.
A testament to scientific progress when those biases were eventually somewhat overcome.
But, and here we go again, echoing the poverty theme, the cost of those drugs. It means AIDS is still devastatingly deadly in poorer communities, especially sub-Saharan Africa.
It brings us right back to that issue of equitable access. We have the tools, but can everyone get them? The answer, tragically, is often no.
So IVAIDS is this complex story, incredible science, but also enduring inequality.
Perfectly sums it up.
And that brings us to COVID-19. Emerging in 2020, the sources really highlight this. Even with all our 21st century tech, a new pandemic hits. It sort of brings home that we can't get complacent.
Not at all. A stark reminder.
Rapid global spread, again, because we're so interconnected now. Massive impact, schools, businesses closed, economies reeling. We all lived through it.
We did. But on the other side, the speed of vaccine development and rollout was remarkable. A real testament to modern medical capabilities.
Was that speed helped by lessons from earlier outbreaks? Did past experiences accelerate things?
Oh, absolutely. Experience with SARS, with MERS, both coronaviruses gave scientists a head start. They weren't starting from absolute zero.
Right.
And technologies like genetic sequencing, mRNA vaccine platforms, these were ready to go in a way they just weren't decades earlier.
So prior research and new tech were key.
Definitely. But COVID also exposed, maybe more starkly than ever, those deep societal divides, the inequalities in healthcare access, resources, all the themes we've been talking about.
Right. Okay, let's pivot to the last category mentioned in the sources. Diseases linked more with aging. The idea seems to be that as medical tech helps people live longer, especially in wealthier countries, we face new kinds of health challenges associated with that older age.
It's almost a consequence of success in some ways. We've tackled many infectious diseases and causes of early death.
So people live long enough to encounter other problems.
Exactly. It's a demographic shift with health implications. As populations age overall, chronic diseases naturally become more prevalent.
Heart disease gets mentioned. The source even kind of playfully suggests maybe it's linked to having more years to eat less healthy food.
Well, lifestyle certainly plays a role over a longer lifespan.
But the main point is, it's now a major health issue affecting millions in developed nations. It seems like progress against some diseases reveals challenges related to lifestyle and just, well, the wear and tear of time.
It does, and it shifts the focus, doesn't it, towards preventative health, lifestyle choices, managing chronic conditions over decades. It's not just about fighting infections anymore. It's about promoting healthy aging.
Right, a different kind of
A
challenge.
very different challenge.
And then there's Alzheimer's disease, described as a form of dementia, hitting older populations hardest.
Yes, a devastating neurodegenerative disease.
The main symptom being memory loss, but it's progressive, eventually affecting basic functions, leading to death. It sounds incredibly difficult for everyone involved.
It is hugely challenging for patients, families, caregivers, the whole healthcare system. It highlights this other dimension of the health burden in aging societies.
Did the sources touch on what helps manage it, since there's no cure yet?
Yeah.
Effective support systems, maybe?
Yeah, they touch on the importance of early diagnosis, comprehensive care. That means medical management, sure, but also, crucially, support. Supportive environments, resources for caregivers who face immense strain.
Practical support.
Practical support, yes. And things like cognitive stimulation, structured routines, non-drug approaches can significantly improve quality of life for a time.
Okay, so let's try to wrap this up. We've covered quite a bit in this deep dive.
They have.
We've seen how diseases tied to poverty just hang on despite medical knowledge, mainly due to access and equity issues.
A persistent challenge.
We looked at epidemics and pandemics, their destructive power, but also how they force us to adapt and innovate.
That disruptive, transformative effect.
And finally, these diseases linked to aging, emerging as a major concern in places where people are living longer lives.
The consequences of longevity presenting new healthcare demands.
And throughout all of this, the constant influence of environment, socioeconomic factors, they're always there, shaping health outcomes.
Absolutely critical context. These patterns really show how interconnected health is with everything else in society.
Yeah, it really leaves me thinking about that tension, between the amazing technological progress we make and the struggle to get that progress to everyone who needs it.
The equity gap, it's arguably the biggest ongoing challenge.
So perhaps for you, our listener, reflecting on these patterns which diseases persist, which emerge, why maybe that helps think about what's needed next. What kind of advancements, medical and societal, do we need to tackle these old problems and whatever new threats are inevitably coming?
A crucial question to ponder.
Indeed. Well, thanks for joining us for this deep dive.